Hello and welcome to the agenda. I am Ajay Kaul. In this program today, we will be discussing how corona has affected treatment of other ailments. Ever since corona entered India about 6 months back, the country's healthcare system has been under intense pressure. Doctors, nurses, and other medical staff have been working tirelessly to cope up with this situation. However, the healthcare infrastructure has not been up to the mark and has got exposed during this emergency situation. Also, because of coronavirus, treatment of other ailments, including cancer, has been pushed to the back burner. There are several such issues, and we will try to understand the extent of the problem in the agenda today. To give us insight, we have with us Dr. VKMongra, Chairman of Hospital Board of India, and Dr. Yash Gulati, Senior Consultant with the Apollo Hospital, Delhi. But before we start the discussion with them, let's have a look at this small report.
It is almost 6 months since coronavirus reached India from foreign shores. And as the pandemic expanded its footprint in the country, the focus of the country's entire healthcare system turned into treating patients afflicted by this deadly virus. In view of the serious emergency, hospitals were dedicated to treating corona patients, and doctors, nurses, and other medical staff were deployed only for this purpose. This put immense stress on the healthcare system of the country, and the inadequacies got exposed. As pressure mounted on hospitals and medical staff, treatment of people afflicted with other ailments, including life-threatening ones, took a back seat. Because of this, lakhs of people afflicted with ailments like cancer, kidney problems, heart problems, or respiratory issues could not get the required treatment. Such people continue to suffer while the focus remained on coronavirus. Definitely treating coronavirus patients has to be a priority, but it is equally essential to keep health services available and accessible for other ailments, because coronavirus is not the only disease that kills people. Therefore, there needs to be a proper allotment of hospitals or wings in the hospital for patients having health problems other than coronavirus. Bureau Report.
So let's welcome Dr. Mongra and Dr. Gulati. My first question is to Dr. Mongra. Dr. Mongra, what are the challenges that have been posed to the healthcare system because of corona?
I think these last 4 months at least, they have been very, very challenging for the whole healthcare system of the country, government as well as the private one. On one hand, this has exposed the hollowness of the government system, and on the other hand, it has shown how important the private sector is. Private sector, which is taking care of 70% of the whole country's health problem, I think it has been brought to a level where the government has now come to understand that it is very difficult to ignore the private sector. And the public health sector country, where we are giving only 1.1% of the GDP to the health, is really deplorable. I mean, you go to districts, villages, and every other towns, I mean, they're pretty bad. In cities, of course, in some places, not all the systems have come up to that level. But I believe this challenge somehow, at least I believe, that in spite of the best efforts of all the governments, we have not really been able to take up this challenge in a way that we should have been able to satisfy COVID hospitals, non-COVID patients, and all the public health system of the country. But I believe we need to do better.
So let me turn to Dr. Gulati. You are a physician and consultant. There are complaints that because of COVID, treatment for other ailments have gone to the back seat. Many people are scared of going to hospital because of getting infected. And there are instances also where doctors or hospitals are not providing, I mean, emergency, unless there is an emergency, they delay the treatment. How do you see it?
Well, I would like to answer this in two phases. One is the phase when there was phase of lockdown and immediate lockdown after that. And one is the phase now. What happened during the lockdown and immediately after that, there was so much of fear, there was so much of anxiety, and there were so many beds reserved for COVID. There were so many flip-flops from the government. And because the situation was dynamic, nobody knew what was happening. So at that time, the 100% focus was on COVID. At that time, people were scared of coming out. Hospitals were scared of taking non-COVID patients. That was true. But now, 3-4 months down the line, situation has changed. We have understood the pathophysiology of the disease. We have understood lots of modes of transmission. We have had time to prepare ourselves. And fortunately, in many parts of the country, as in many parts of the world, COVID is now showing downward trend. Let me just put it in the right perspective that this corona-induced COVID-19 is a dynamic situation. In one part of the country, it may be showing surge, and whereas in other parts of the country, it may be showing downtrend. For example, if you see in Delhi, it is showing downtrend. Where there were 4,000 cases a day, now it is under 1,000. So it is true that initially everybody was very scared. Now confidence is coming back, and it is true that non-COVID patients were hugely ignored because of fear on the parts of the patient, because of various other factors, and we could have been sitting on a hidden pandemic of untreated non-COVID diseases. But a time has come to take a relook at that, and now under these circumstances, we need to strategize ourselves to treat non-COVID problems also, because just imagine that all those problems have not disappeared. COVID is just one disease. All other problems are there, cancer, heart disease,
that's what I wanted to point out. There are neuro issues, somebody has a fracture, or maybe somebody has to go for dialysis, or somebody has to go for chemotherapy. Those are all treatments have gone to the back burner.
Perspective has changed. Now, I think we have to concentrate on non-COVID diseases more than on COVID. Because we have understood the COVID pathophysiology, we need to now decrease number of beds reserved for COVID in hospitals. We need to release those beds. We need to, most important thing is we need to bring back confidence in people. And that can happen on 3 or 4 fronts, by the government, by the media, by the hospitals, by the doctor, and by the patients themselves. All these things are important, because if we don't treat non-COVID disease, then we will have a non-COVID pandemic at our hand. So we cannot ignore those things. For example, we can't ignore cancer, we can't ignore fractures. Otherwise, you'll have to, after 3 or 4 months, you'll find many cancers which could have been treated have now become untreatable. Many heart diseases which could have been treated have become untreatable. Many patients who are on dialysis and needed dialysis did not get it, have not survived. So really speaking, we need to now tighten our belt, and we need to concentrate on non-COVID disease also.
Dr. Monga, as Dr. Gulati says, we need now to go for no COVID treatment also and bring back the confidence. But I suppose maybe he's talking about private hospitals. There may be some people may be coming there, some patients. But government hospitals, I don't think they are even treating such other non-COVID patients. What do you say?
No, I agree with Dr. Gulati as far as Delhi is concerned. But if we talk about the whole of the country, I believe there is still a lot of pressure on beds, ventilators, and everything else also. Delhi, I believe, with the home quarantine system, number of beds occupied in government as well as private hospitals has decreased. And that is the time when Delhi government at least should relieve some of the hospitals of their commitment to admit COVID patients. Because till now, I believe, if we analyze the smaller hospital issues, that's more than 50. These hospitals were supposed to give 20% beds to COVID. And that 20% means you are mixing the patients. In most of the hospitals, there were no to entries, no to lifts, no to casualties, no to arrangements were there. And we were mixing the patients COVID as well as non-COVID. I think for the first stage, we should tell them, I mean, it's okay now, we don't require your beds. Similarly, in many hospitals, the government has given 80% beds to COVID, 20% to other non-COVID. Slowly, the government should release COVID beds and increase the number of operations, deliveries, and admissions, dialysis, cancer treatment, and everything in a non-COVID part of the hospital. Slowly, gradually, we will have to come up to terms, It is not a one-day disease. It will take months and maybe years also to really, take up COVID as such, unless vaccine comes, how effective will be the vaccine, how long-lasting will be the vaccine effect. All these things we will learn slowly and slowly. It is not that we had all the information and we were able to do it. But Delhi government, if we talk about it, they did a robust arrangement by involving private sector, by involving banquet halls, hotels, quarantine centers, and big quarantine centers were made in the city for that eventuality. And at one time, everybody knows that there was a lot of pressure on beds in Delhi. All private hospitals were full, and government hospitals, people were really not wanting to go, but they did go there. But I think slowly and gradually, we'll have to release that pressure on the hospitals in Delhi. But overall, throughout the country, the pressure on beds, the public health system is even now very immense. And governments all over the country, state governments, they are trying to increase the number of beds. And in fact, UP has now started home quarantine also. So all these things are just, you learn. It is a learning process and it may continue for months.
But Dr. Mongra, won't you agree that the whole health infrastructure has got exposed because of COVID? Because it has been lopsided, the whole focus has been lopsided. While private sector has been booming, the public sector has not been given too much of attention, appropriate attention, I would say. And that is why we are in a situation that people are running helter-skelter to get treatment. Will you agree?
You're right, Ajay. I initially said because of the GDP, expenditure on health, it has been too meager. And we have not been really, able to take care of the basic health problems of the country. Article 21 says, right to good health, right to good living. But ever since independence, the population growth has been so exponential, and the amount spent on health was so bad, in a way that we were not really able to provide facilities to the masses. That is why this private sector came up. And when this private sector brought in all the latest ultra-modern facilities, ultra-modern structure, and then the systems over there, the best of the world's surgery, medicine, and all the departments are there in private sector. That is why, in spite of the fact that they may be costing, but people prefer to go to private sector also more into them because they want better services, more cleanliness, more hygienic conditions, and better doctors and better behavioral part of the hospitals also. So these have been the factors slowly. The emergence of the private sector has been such a big factor in Indian health system. But on the same line, I'm sorry to say that there has been a lack of confidence by central government, all state governments also, in private sector. They have really, not treated them at par or even at a higher level once it came to the healthcare delivery. They should have recognized their part. In fact, the private sector participated in almost all government activities over the years. But then they were not given their due coverage, they were not given their due place. So I think this has been somewhere, dichotomy in the process over the years.
It's a sad story, in fact, that for 70 years, 7 decades after independence, India had only one AIMS. So that tells the whole story, isn't it?
Yeah, you're right. And, even now, for example, when COVID started in the country, I mean, there were 2 or 3 meetings in the government. I had the opportunity to go there. I mean, their reluctance to have, partnership with private sector for admission, for their care, and then on top of it, for their diagnostic testing facilities. They took a lot of time in ensuring that private sector can also do these RT-PCR testing. This was non-confidence. But in spite of the fact, I still believe that private sector has better facilities for treatment as well as testing, and they can be relied upon much more. But we thought that, at this time of crisis, the government should have laid more stress and, in fact, encourage the private sector also. This has not been done.
So, Dr. Gulati, as Dr. Monga says that he has been talking to government and government should have consulted or taken the partnership of private hospitals. How do you see the government's handling of the COVID situation overall?
Look, this was a very difficult situation, no doubt about that globally. And Indian government, including the state government, had to flip-flop because this was such a dynamic situation. Things were changing every day. Overall, I think we have done well as a country, as a government, as hospitals, whether it is government hospitals, private hospitals. I think we have done reasonably well. And I must say that private hospital, private healthcare has contributed equally, if not more. Everybody has been treating, everybody has been contributing. There have been beds, there have been patients in the ICUs, and every infrastructure was thrown open to all the patients. So everybody has partnered in this, and I think we are doing reasonably well. This is a pandemic, it will take its own time. It is coming down. My assessment is that as a country, we haven't done badly.
But you say government has not done badly. When we had first lockdown, the idea was to build the infrastructure in that interim period, isn't it? But after the lockdown 1, 2, 3, 4 ended, we saw patients running from one hospital to another hospital looking for beds, and beds were not available, and some people died outside the hospitals. So how can you say that government has done well?
Well, it is, in the beginning, there was a lot of confusion. As I said, there were a lot of flip-flops, even in orders, even in directions, even in the testing, because it was such a dynamic situation. I'm not a die-hard government fan, but we have to understand the dynamics of the situation, the huge number of our population, and relatively poor infrastructure in the country. As you yourself said, that our investment in infrastructure has been very bad. We are spending only less than 3% of GDP on health infrastructure. So considering that, of course we need to change that. We need to make our health infrastructure much better. But that cannot happen in one day. We have to learn a lesson that, look, this is what is important and we need to invest in that. Investing in health is investing in your economy at the end of the day. Most bureaucrats and politicians think that investing in health is expenditure in which you are not gaining benefit out of that, or you're not making profit. By keeping people healthy, this is the biggest profit you can make, because they are the people who are going to work in the country. That's your workforce. So our mindset has to change. But considering the cards that were on the table, our relatively poor infrastructure in the country at this point of time, I'm not justifying that poor infrastructure. But with that, I think we haven't done badly. You can now see the beds are available everywhere. But in future, we have to learn from our past. For future, we need to make our health infrastructure much more robust than it is.
But Dr. Gulati, the real test comes in an emergency situation. In normal situation, any government can do well. But real test is when there is an emergency situation.
So that is exactly what I'm saying.
If we take the example of China after this pandemic outbreak of this pandemic, within days they set up 10,000 bed hospital somewhere. They occupied a large part of land and they set up 10,000 bedded hospital in days.
Look, let me just clarify this. There hasn't been a deficiency of bed. Where we went slightly wrong is that we did not train enough personnel. See, you need to have doctors, nurses, paramedics trained to handle those things. There are so many beds lying vacant. You can see this.
No. Dr. Gulati, let me correct you. There have been several cases of patients not getting bed. In fact, I heard RML Dean, when he got positive, he wanted a bed in his own hospital, and he was told that bed is not available.
Well,
So that was the situation.
That way the health ministry of Delhi, was he also told there is no bed available in government hospital? I don't know. I mean, let's not
So
go
maybe
into all this.
let me ask Dr. Monga about whether government did it. How did the government perform on this?
Ajay, I don't agree with you completely, because when the first lockdown was announced, there was not even one PPE kit made in the country. I'm telling you the benefits of the lockdown. Number one, we were able to delay the process of the disease, the onset of the disease. Then there was not a single PPE being made in the country. Now we are making around 4 lakh PPE kits in the country per day, and we are in fact exporting. Then you come to gloves, you have masks, and then on top of it, we have been able to, manufacture so many medicines which we are exporting, even paracetamol, HCQ, we are exporting to 133 countries of the world, just because in that meantime, we could increase our production capacity, delay the process of the disease, and get prepared to a large extent to take care of the disease. I mean, it is not that, health
So Dr. Monga, if I play devil's advocate, I agree with you, PPEs were not there, ventilators were not there, they were manufactured, masks were manufactured. But I think private sector got in and played a big role in that, isn't it?
That is, even the government should agree to that. That private sector has partnered really well, and that is what Dr. Gulati was saying.
I am here talking about the governments, like creation of beds with good equipment, making beds ready for the unforeseen situation with cases rising, and visualizing that after 10 days, maybe one month, how many beds will be required, isn't it? But they fell short of that.
There is a difference, Ajay. In China, you talked about it, there was only one city, Wuhan, which was mainly affected. They could control by sealing off the whole boundaries and everything over there, and then maybe erecting a hospital.
No, let me clarify. Here I am not talking about central government or any government. I am talking about state governments also, any government.
I'm talking about that only. And they could do it. But in India, our structure has been exposed, number one, that is pakka. But, overnight building hospitals of that level, when China had only 80,000 patients, and we have had around 12 lakh patients till now also. And this is, different problems, different issues. The modernization in China has been, to a higher level than India as far as the health structure is concerned. But overall, I believe we have faced the situation well, and I have all my faith in central government led by Modi ji and my state governments. They have done really well in all these crucial timings and in these testing timings. They have done pretty well.
But how will you comment on the contention or maybe allegation that appropriate number of testing is not done? So that is why the cases are not, the real case number of cases is not being, coming out.
Initially, yes, you're right. Initially, we had only one lab in the country, Pune. And then I remember towards the end of February, the government gave license to 52 labs in the country. Now it is more than 1,100 labs in the country who are doing tests. And variety of tests are available. We are doing rapid antigen also, RT-PCR also, and serosensitivity also. So all these things over the years we have developed. Definitely, I agree with you that in the beginning we were at a naught, we were nothing. But now we have come to a level where I believe more than 3.5 lakh tests were done yesterday only. And till yesterday evening, the figure of tests in the country is more than 1.5 crore. It's a good number. We are doing it. But definitely more the tests, more the diagnosis, more the better we are capable of handling the situation. That is a basic. Testing has to be basic, and government and ICMR are taking steps to increase the number of tests per day.
So Dr. Gulati, do you think that the testing facilities should be decentralized, maybe more private hospitals, clinics should be involved in this?
My philosophy is different in life anyway. I think everything should be decentralized. You people, you have to empower people. You have to empower smaller people. You have to empower everybody. I don't know why there was so much of confusion. There were so many pitfalls, so many stupid orders at one point of time that you can do this guy's test, you can't do that guy's test, that guy can do and this guy can't do. I mean, in a situation like this, you should allow people to do tests. I mean, if for some protection somebody wants to do tests before admission in the hospital, there were orders you can't do it. So, to answer your question, yes, it should be decentralized. There's no question about it. Unless we do that, we will not be able to control things, not only in this pandemic, but in many things in life. So I'm strongly in favor of what you're saying.
So the testing should be decentralized and government should do more and maybe pay more attention to healthcare system. Thank you so much. We are running out of time. Thank you both of you for participating in this debate. This is all in the agenda today. Thanks for watching. I will come back with another important topic tomorrow. Till then, goodbye.